Hello, Dr. Sean here. Thank you for choosing my video. I'm going to share 3 signals from the liver problem and 3 fundamental solutions and discuss the types and dosage of supplement that have received the best feedback from my patients. Fatty liver is challenging to detect because it often shows no symptoms. Diagnosis of fatty liver is typically done through methods such as ultrasound and blood tests. Depending on underlying causes, fatty liver is classified into alcoholic fatty liver and non-alcoholic fatty liver. If left unmanaged for extended period, fatty liver can progress to cirrhosis, a condition where the liver becomes hardened. Occurring in about 10% of cases, this can lead to liver cancer. Right now, I'll tell you about 3 symptoms that occurs when transitioning from fatty liver to cirrhosis. Firstly, there is a symptom of abdominal swelling, known as ascites. Normally, the liver should synthesize protein called albumin. However, when the liver becomes hardened, the synthesis of this protein decreases. As a result, the excess fluid that should be excreted in urine may accumulate in the abdomen or other area, such as legs, leading to symptom of ascites. Secondly, there is a symptom of vomiting blood, which can occur due to esophageal varices or gastric variceal bleeding. When the liver becomes hardened, the blood that should go to the liver cannot reach it. Instead, it goes to the esophagus or stomach. This redirection can lead to significant increase in the blood pressure and risk of sudden rupture. Thirdly, there's a symptom of hepatic encephalopathy, a change in how your brain functions. Toxic substance like ammonia should be excreted from body. But in the case of liver cirrhosis, this substance may not be excreted efficiently and accumulate in the body. This accumulation can lead to hepatic encephalopathy, causing symptoms of confusion and altered consciousness. Alright, now we know there is an issue with the liver. What's the first thing that comes to mind? Probably what to eat or take, right? However, that's very modern medical approach, thinking that disease equal to medicine. In other words, finding cure rather than addressing the underlying causes first. In Eastern medicine, the focus is on the cause, the root cause. So let's first look at the what not to do. First, we can broadly divide it into 3 categories. First one is overload, second one is inflammation, and third one is nutrition deficiency. First, let's start with number 1, overload. There are 4 main contributors: alcohol, sugar, grain, and toxins. For those with alcoholic fatty liver, you already know not to consume alcohol. So let's move on. Next is the sugar. When I say sugar, I mean fructose, because fructose is harsher on the liver than glucose. Glucose can be processed in every cell in our body, but fructose is only processed in the liver. As sugar is a 50% glucose and 50% fructose, half of sugar intake goes to the liver. Similar to alcohol, both can be harsh on the liver, affect the brain, and can be addictive. Quitting sweets is very hard, isn't it? Next is grain, especially being careful with high starch content like flour and corn. I strongly recommend avoiding them because they act very similar to sugar when ingested into our bodies. They are also one of the most common ingredients in processed foods, so cutting down on them is important. Next is toxin. I would say the most common toxin we encounter daily is our prescription medicine, such as diabetes or hypertension medicine. While the liver can process them well, if its function is compromised due to excessive intake of alcohol and sugars, the detoxification capability may decrease. Consequently, this medication becomes stressor on the liver. Next is inflammation. Among the various reasons that cause inflammation, the most prominent is insulin hormone. If a person has an insulin resistance, it means there is excess of insulin, leading to increased inflammation in the body. This is one of the reasons why overweight individuals often experience high levels of inflammation. The most effective way to reverse insulin resistance is through intermittent fasting. It's cost-effective, easy, and above all, safe. I strongly recommend giving a try. And secondly, let's talk about oils. What kind of oil do you use for cooking? Avoid oil-rich omega-6 fatty acid such as corn oil or sunflower oil. Avocado oil is great for cooking, And remember, olive oil should not be heated. Another significant factor is stress. While stress is considered the root of many diseases, let's see how it operates here. When stress is high, even if you fast, blood sugar levels rise and insulin levels increase, leading to increase in inflammation. Finally, there is a nutrition deficiency. While nutrition deficiency poses a risk of progression of fatty liver, I see it more as an obstacle to recovery. Nutrition deficiency may not be common for us living in the States in 2023. However, if you're neither overweight nor diabetic but have been diagnosed with fatty liver, it's something worth to considering. So first thing to think about is the bile. The bile produced by the liver helps break down fats. Make sure to incorporate good fats like olive oils into your diet regularly to encourage the liver to produce bile. Think of it as giving your liver a cleaning. For those with insufficient bile production, some may consider using a supplement like this one. Additionally, substances like choline and glutathione can be beneficial. But among the feedback I received from patients, the combination of 250 to 5 mg of silymarin from milk thistle and 1500 mg to 2000 mg of L-carnitine has shown the most positive effect. Since there is a lot of information, let me summarize it for you. So how do you go about recovering from fatty liver? First things first, if you are someone who drinks alcohol, it's important to quit. Also, cut down significantly on sugar and reduce the intake of processed food. It's better to eat at home rather than dining out if you can. Consider intermittent fasting. It can be even more beneficial. Doing all this will naturally help you manage your weight. Lastly, don't forget about stress management. If you want to get supplement, take milk thistle with L-catenin. How was today's video? As we look forward to a life expectancy of 100 years, it's essential to take care of our health in advance, so we have no regrets. Please hit the like and subscribe to the channel, and until next time, stay healthy.